Just last week, a doctor in a physician Facebook group posted that integrative medicine is just about supplements and it's a cash grab. It's all a big scam. Then on the same day, one of the clinicians in my integrative sleep medicine program for clinicians said, integrative medicine is too expensive for my underserved population. Where can they get low-cost supplements? So these were two totally different contexts, but it led to the same exact assumption, which is that integrative medicine is all about supplements. That assumption is deeply limiting because integrative medicine is not about supplements only, and that belief actually gets in our way to effectively help patients with sleep, with mental health, and with their overall physical health and well-being. Before we dig into this, I'd love to hear from you. Have you done any training in integrative medicine? Let me know in the comments below. Today, I'm going to reframe what integrative sleep medicine actually is, and I want to show you some of the evidence behind it and how you can use these tools in your clinic tomorrow without expensive supplements, without expensive devices, without extra lab tests, or the overwhelm. So we're going to start with the biggest myth, which is that integrative medicine equals supplements. So most people, even clinicians, hear integrative and think supplements, fancy devices, fancy sleep trackers, blue light devices, blue blocking glasses, expensive functional lab tests, or some kind of alternative medicine quackery or upsell. So let's clear that up. Integrative medicine is not about rejecting conventional evidence-based medicine, nor is it about blindly accepting alternative practices. It's about evidence, physiology, personalization, and collaboration. The NIH's National Center for Complementary and Integrative Health actually lays this out beautifully on the slide that you see here. Supplements are one small piece of the puzzle, as you can see, but integrative care spans mind-body medicine, movement, circadian tools, behavioral strategies, environmental adjustments, lifestyle foundations, nutrition, relationships, and so much more. So supplements are optional and they're often peripheral. I had a patient who'd been struggling with sleep and depression for many years. He was already on an SSRI and bupropion, and he was seeing a therapist. And he was still struggling. And every time he came in, I spoke to him about lifestyle adjustments and other ways to support his mental health and sleep. And finally, he came in and said, you know what, I don't want to add any new medication. I don't want to adjust my medication. He was open to trying a more integrative framework and applying some lifestyle strategies. And nothing too extreme. But he came in a few months later and said to me, oh my goodness, I'm feeling so much better. He started walking every day. He was getting bright sunshine in the morning. He started drinking more water instead of relying on caffeine or sodas throughout the day. He started setting boundaries around screens, and he started committing to a consistent wind-down routine and spending more time with his family. And when he came back to see me, he was glowing. He had lost weight, he was sleeping better, he was feeling better, he was less depressed, and he laughed and said to me, who knew this stuff actually works? Now, it wasn't a cure-all, but it was a significant and meaningful improvement in this patient's life. This was all done through free physiologic, evidence-based tools. And that's the whole point. That is the essence of integrative medicine. Integrative sleep medicine isn't about adding more things, but it's about using the right things. If you want to go deeper with your sleep medicine knowledge, then go ahead and get my free sleep mini course for clinicians. You can get that at IntraBalance.com/doctors, and it's filled with lots of clinical, practical tools you can use in your practice today. The link to that is in the description below as well under this video. Okay, so another big misconception is that integrative medicine is alternative. And the thing is that it's actually not alternative. It's based in biology, it's based in psychology, behavioral science, and it's based in collaboration. So I had a 24-year-old female patient who came to me with severe insomnia and anxiety. And she had been prescribed 800 milligrams of quetiapine by another psychiatrist. And it wasn't helping. And she came to me because she wanted a more integrative approach. She was exhausted, physically, mentally, emotionally, and she did not want to be on this dose of medication for the rest of her life. So together, over the course of a year, we created a plan. This was a collaborative pathway that the patient and I worked on together to shape. We were able to slowly taper her medication. We started introducing ACT, which is acceptance and commitment therapy, and mindfulness tools. We used principles of CBTI, which is cognitive behavioral therapy for insomnia. We introduced breath work. We did a lot of mindset work. Exercise and movement was part of her treatment plan. We used journaling, reducing social media use, spending more time with loved ones and friends, and reconnecting with her values was a big piece of what we worked on. I also introduced her to the concept of what I call vitamin J, which is all about joy and finding ways to connect with that in your daily life. She was also working with a psychologist. Supplements were a tiny part of her treatment plan, where we're using an iron supplement to supplement a mild iron deficiency anemia and a vitamin D supplement for mild insufficiency. These were peripheral to her treatment plan, not central. Today, this patient is medication-free and she is thriving. It took us over a year to get her to her goals, and she actually just emailed me a few weeks ago to say, I never thought this was possible. The old me that came in to see you never would have imagined that I'd be off medications and doing so well with managing my sleep and my anxiety. She was incredibly grateful, and nothing we did was expensive. We weren't relying on supplements or complicated lab testing. What we did was pretty basic, but it was evidence-based. It was personalized to that particular patient situation. It was driven by her values, and it was collaborative. So that is the essence of integrative sleep medicine. For your clinical practice, if you want to start practicing in a more integrative way, especially with regard to sleep issues, the most important question you can ask your patients is, where do you want to start? Patients will engage more and they'll change more when the direction comes from them. So you can give them options, like, do you want to start getting more sunlight first thing in the morning? How about adding a daily walk for 5 to 10 minutes? Would that feel doable? How about one extra serving of vegetables each day? Is there something joyful that you could do this week? Do you want to try a 2-minute breathing practice at bedtime? Let them lead the way and start with what feels nourishing and doable in their life. These aren't just basic tools, they're actually biologically powerful tools when done consistently that will move the needle for that patient's sleep and their overall health. And you're not prescribing a list of things for them to do that feels like more of a chore and feels more overwhelming for them. You're really partnering with them as a coach. And you can use more coaching questions, like which of these feels easiest for the next 3 days. Let's experiment and see what changes. This is about rhythm and progress, not perfection. If you want to go deeper into integrative sleep medicine, I do recommend the Integrative Sleep Medicine textbook that was edited by my friend and colleague, Dr. Valerie Cacho. I have no affiliation with this book. It's just a useful resource that I use in my practice and something that you might want to have for your bookshelf as well. Another great starting point to learn more about integrative medicine is the NIH's National Center for Complementary and Integrative Health website. You'll find lots of good evidence. That's also a great starting point to learn more. But you don't need anything fancy to get started. You can start tomorrow by asking your next patient, what's one tiny shift that feels doable for you this week? So ultimately, integrative medicine is not a scam. It's not a cash grab. It's simply good medicine. Real integrative medicine is evidence-based, it's personalized, it's collaborative, it's foundational, and it's accessible. If you feel the call to practice in this more holistic way, then you're already on the right path. And if this video resonated with you, then subscribe for more evidence-based integrative sleep medicine tools that you can use with your patients and clients in your practice.